Dr. Nicholas Mercer with You Improve PT. I'm back making another video. So I had someone ask me about thoracic rotation, having pain with thoracic rotation. Every time they turn, they try to do some type of turning from their upper spine, they're getting a lot of pain. And one thing that we learn in DPT school and the physical therapy programs is we have to start where you're at without pain and slowly progress over time. So for thoracic rotation, one of the things that can go wrong is a lot of the muscles back there will get really tight. They don't want to let go. They don't want to relax for a multitude of different reasons. But the first thing we need to do is make sure that we can expand that rib cage in the back and let those muscles relax a little bit. So we'll start with that breathing technique, to help everything back there relax. Then we'll start with gentle thoracic rotation, making sure it's not painful. Then progress to a little bit more thoracic rotation where we don't really have to resist gravity. We don't have to do too much active movement from those muscles. We'll get a little bit of activity, but not enough that it's going to make all those muscles guard in pain. And then lastly, we'll move on to kind of a more difficult position to perform thoracic rotation. Again, this is building up over time, over days, weeks, even months to get to this last progression in order to get thoracic rotation that's not quite as painful. Now for these, you're going to want to do you're going to want to do both sides. Regardless of which side you feel the pain and restriction in. And we're going to do that for a couple of reasons. But the main reason is the side that doesn't bother you, if you do have one side that doesn't bother you, we want to mentally think, I want the side that hurts to eventually feel like this side. And so just by using that neuromuscular connection and being able to feel what's going on, it will help progress that movement. So first way to start gently getting a little bit of thoracic rotation in is going to be, we're going to start in this position, knees bent, and flex a little bit at the hip so that we lock in the lumbar spine a little more. And you've probably seen this exercise before, open books. We're not going to do that yet because that is, if you're having pain with thoracic rotation, that may increase your pain. We're going to start even gentler, right? First, we're going to focus on the breathing. So as you inhale through your nose, you want to expand the back, like you're trying to get your back as wide as possible. Put all the air into the back of your rib cage. And then as you breathe out, try to let all of those muscles relax. Right? Start out taking a few breaths there. Inhale. Expand the rib cage. And then exhale. And now, all you're going to do is just a little shift with the hand. So keep the arm straight. You're going to shift the top hand forward. Again, maintaining that nice deep breathing, and then shift it back. Allowing those muscles to relax, relying on the side so that we don't have to increase the tone, the control of the muscles. So we can just get that joint moving a little more, all those joints. Okay? So once you feel like, okay, I'm getting a little bit more rotation, I think I can be a little more comfortable bringing the arm up. So then we'll progress to, again, keeping that deep breath, starting out with a nice big inhale, expanding the back, and then as you exhale, looking towards the hand, and just getting as far as you can without pain. You may only get to here, you may only get to here. That's fine. You want to stay in that pain-free range of motion. So we'll come back, looking at the hand, rotate that thoracic spine, try to keep those knees on the ground, hold for about 5 to 10 seconds, and then come back. All right? Again, you're going to do this on both sides, and over time, as this starts to loosen up, become less painful, we can control it a little better, that's when we're going to start to have some fun. So once you can do a few sets of 10 of those open books without an increase in pain, we're going to move on to a more difficult exercise, one that requires you to use those muscles now. So You're going to get into what we call a quadruped position, hands and knees. And you're going to take one hand, place it over your head. Okay. And from here, you're going to look at your elbow and try to get that elbow up towards the ceiling and then back down. Again, up towards the ceiling and back down. Okay, so this one, we're adding gravity into the equation, making you resist that body weight from the arm and really get that active rotation in. Again, only going so far as you don't get an increase in pain. You may start here and then over time be able to work it a little higher. Okay, so that's a good way to kind of get started getting that thoracic rotation back without pain. Now, if you're doing these exercises and you kind of reach a plateau where this pain is just not going away, it's highly likely that you're going to need some manual therapy from a skilled physical therapist to free up some of those joints, get those muscles in the nervous system to calm down a little bit, get some input into the system from a skilled professional. And that's why it's so important to have a physical therapist that you know and trust to help you get your body moving the way it needs to. If you live in Florida, you improve PT, that is something that we specialize in. We make sure that our patients are moving well and we make sure their joints can move well. And then we allow them to get the tools and techniques they need to maintain that progress so they don't have to keep coming to see us every week, every 2 weeks for several years or even the rest of their lives. Get you back to maintenance and then you keep it there to live a long, happy, active, pain-free life. So if that's something you're interested, you live in Florida, we're located in Oviedo, so please, you'll find all our contact information below in the description, and we are looking forward to helping you get back to all those activities that you love to do without pain and dysfunction.